Hi, welcome to my channel. My name is Dr. Harshita and you are watching my channel Psychology and Life. Today is May 24th and this day is known as World Schizophrenia Day. What is schizophrenia? Schizophrenia is a disorder that affects a person's ability to think, feel and behave clearly. The exact cause of schizophrenia isn't known, but a combination of genetics, environment and altered brain chemistry and structure may play a role. Schizophrenia is characterized by thoughts or experiences that seem out of touch with reality, disorganized speech or behavior, and decreased participation in daily activities. Difficulty with concentration and memory may also be present. Treatment is usually lifelong and often involves a combination of medications, psychotherapy, and coordinated specialty care services. Coming to the common symptoms of schizophrenia, the common symptoms are remaining aloof, loss of interest, aimlessness and social withdrawal, muttering and smiling to self, disturbance in thinking and perception in the form of delusions, hallucinations, and unusual bodily sensations. They may also have persistent delusions that are culturally inappropriate and implausible, such as religious or political identity or superhuman powers and abilities, or that they are being talked about, stalked and followed, spied by some agencies. They may hear voices or see images which in reality may not exist, irrelevant or incoherent speech. They may feel that their thoughts are being broadcasted on television and internet, their thoughts being withdrawn by some external power, or they may not recognize that their thoughts as their own, as if being inserted from outside. Inappropriate and blunted affect, disinhibited and disorganized behavior and speech, inability to maintain activities of daily living, poor self care and poor hygiene, decreased sleep and disturbed appetite, abusive and assaultive behavior, mostly in response to commanding voices and suspiciousness. Not every individual with schizophrenia may exhibit all of the symptoms mentioned. How to manage the condition? Family members and other significant people can help by first taking the individual with these symptoms to a mental health professional for psychiatric consultation as early as possible rather than taking them to faith healers. These changes occur due to various factors in which the prime cause is an imbalance in neurotransmitters which can only be managed through proper and timely medications. Moreover, these behavioral changes are due to neurochemical imbalance and should not be seen as a character flaw or a sign of being possessed. Additionally, they should not try to correct the individual's behavior or should not get into arguments with them as they are not in a state to comprehend right and wrong. This might make them even more agitated. Apart from that, family members should try to maintain a stress free environment around them as stress can aggravate the symptoms. Many people ask that can a person with schizophrenia lead a normal life? The answer is yes. People affected with this particular schizophrenia disorder, being on regular treatment and adhering to medication, can live a normal life. They can pursue their studies, make friends, maintain relationships, and have a successful working life. These individuals can choose to marry and fulfill the roles and obligations of a marital life provided they are on regular medication to remain symptom free. As marriage is a significant life event which brings about a lot of changes in one's life, with a good family support system and one's own preparedness about the possible stressful impact, they can have fulfilling marital life. Another question which arises about schizophrenia is that are people with schizophrenia dangerous to people around them? The answer is that people affected with schizophrenia exhibit aggression mostly secondary to hallucinations. Hallucinations, that is, hearing voices speaking to them, threatening them, or commanding them. Delusions, which are persecutory in nature, and distorted ego boundaries, which impairs their judgment about reality. Thus, people with schizophrenia are not dangerous to society, but they could potentially harm themselves or others, both known and unknown, as a consequence of their abnormal psychic experiences. Due to lack of awareness about mental illness, general people may perceive a threat from their actions, and more so for the social inappropriateness in their behavior. It is preferable not to be aggressive towards them, call them names, or openly criticize them. Rather, an empathetic approach proves to be more promising. Celebrating World Schizophrenia Day, the theme of this year is Discovering Better Mental Health. Explaining this theme better, there are four pillars to better mental health. Number one, acceptance. Number two, self stigma and stigma. Number three, contribution. And number four, support of peers. What do we mean by acceptance? As you learn to accept and make peace with the way things are in this very moment, you step out of your own way and step forward on the path to growth. The more often you practice acceptance, the more you will see that each moment has a purpose, a lesson to teach you, and a reason for unfolding the way it does. When we talk about self-stigma and stigma, basically what we are referring to is that self-stigma occurs when people internalize public attitudes and suffer numerous negative consequences as a result. Third, talking about contribution, one should be very mindful of such factors which play a role in contributing to positive mental health, and at the same time should be very cautious as to what things are hampering their own mental health. Fourth, support of peers. We often underestimate the role that family and loved ones play in our life. It is extremely important that you take the support of your peers as and when needed. May 23rd to May 29 is observed as Schizophrenia Awareness Week. Please look out for individuals who may be suffering from the symptoms mentioned and consult a psychologist or a mental health professional if necessary. That's it for this video. If you like the content of this video, please like, comment and share this video. Also, don't forget to subscribe to my channel. Thank you.